Good evening. I'm Cheryl Owens, the president of the Iota Gamma Omega Chapter of Kappa Alpha Sorority Incorporated. And on behalf of our 754 members, I'd like to welcome each of you to tonight's program on Pink Goes Red Impact Day. Did you all know that one of every 2 women attending tonight's program might have some type of heart disease and you don't even know it? Heart disease is the #1 cause of both death and disability in women in the United States. And as Black women, we have an even higher rate of dying of heart disease and at a higher age compared to white women, according to the National Heart, Lung, and Blood Institute. When it comes to high blood pressure, African Americans, both men and women, are diagnosed more often than other ethnic groups. And when you break down the numbers by gender, more Black women have high blood pressure than Black men. So tonight, our Women's Health and Wellness Committee, led by Ms. Wanda Smith, chairman, and Rachel Robinson, the co-chair, have put together with their committee a great panel of African-American women in our area to shed more light on this subject as we all learn more about heart health and what we can and should do to take better care of ourselves. In advance, I'd like to thank all of our panelists, Dr. Outler and Dr. Wyche, and the committee members for planning this very important event. And I thank each of you for joining us tonight. So in recognition of being respectful of your time, we're going to keep the program going. And I'd now like to turn the program over to Danielle Singleton, who will be our moderator for tonight's program. Danielle.
Thank you, Madam President. And thank you all for joining us this evening. I think this is going to be a wonderful event, very impactful as well as educational for a lot of us. So I appreciate you joining us this evening. I'm first going to introduce our cardiologist, Dr. Roquell Wyche. Dr. Wyche is a native of Washington, D.C. with a passion for health and a love for her community. She's a public health focused cardiovascular specialist and a health advocate who believes in the efficacy of local health outreach. She participates in numerous local health programs every year with the goal of promoting health, especially in women, attempting to prevent disease via mitigation of cardiac risk factors. Dr. Wyche has served as a speaker, host, and panelist for many community-based organizations and media outlets. She has served as the Advocacy Committee Director of the American Black Cardiologists, the President of the Greater Washington Region American Heart Association, and is currently the Chair of Leadership Development for the American Heart Association. She continues to work to empower patients to take charge of their health and their hearts. Now, I'm also going to go ahead and introduce Dr. Kendra Outler, who is joining us as well. First, Dr. Wyche will speak and then Dr. Outler will speak. But just to give a little bit of information about Dr. Outler, she is a staff anesthesiologist at Walter Reed National Military Medical Center, where she is involved in both academic and clinical medicine. She has a prior career in public health. She founded Uzima Health and Wellness to raise awareness about health disparities during this time of COVID-19. She has been featured on blackdoctor.org, the Thelma Jones Foundation, and the Rodham Institute as an impact speaker. Tonight, we welcome her and Dr. Wyche for our Pink Goes Red talk about heart health. And I'll turn it over to you, Dr. Wyche.
Thank you very much, and thank you for being here. I'm really loving that everybody's rocking the red, so thank you for that. Whenever I give talks to women, I must first acknowledge that we are all individual superwomen. We have a capital S on our chest. We take care of our homes, our significant others, our children, our parents, and this is all while we are working full or part-time jobs, and we're also dealing with the stress of an ongoing pandemic. So if we have a little tightness in our chest, dizziness, can you hear me now? Okay. Okay. So we're much more likely to dismiss our symptoms. You know, we don't want to take our cape off. We have too many things to do. But Women are more likely to have atypical or subtle symptoms in comparison to men. So when men present, they give us textbook chest pain. So it's middle of the chest, feeling like an elephant is stepping on your chest, and it is chest tightness. It's textbook. And sometimes women can give us those same symptoms, but we're more likely to have subtle symptoms. And this can be a chest discomfort that may not necessarily be tightness. It doesn't have to be in the center. It can be on either side of the chest. It can radiate to the jaw, the neck, even the back. We can have unexplained dizziness or lightheadedness, shortness of breath that is new. And when I say new, I mean something that you're normally able to do, and then all of a sudden now you feel short of breath when you're doing it. So you climb a flight of stairs and then you feel short of breath, and that's new. Feeling nauseous or feeling hot and sweaty, or even like cold sweats. All of these symptoms are very concerning. And if you have these symptoms, or if you know someone who experiences these symptoms, you must call 911 immediately. So for the heart, every second counts. Time is muscle. So the sooner you can get treatment to start, the better the outcome. For some reason, a lot of women, they delay it. So they don't actually call 911. In fact, women are more likely to call 911 for someone else than they are to call for themselves. And this is even if they think they're having a heart attack. So women are more likely to delay the treatment. Sometimes women don't want to get to the emergency room and have someone say, hey, this was just anxiety. I don't even know why you came. They don't want to look silly, or they have work obligations, or they're trying to make sure that their kids are okay before they call. So the important thing to remember, if you have any of these symptoms, you want to call 911 immediately. Now, when we think of heart attacks or strokes or any type of cardiovascular disease, many times we are shocked. So if it happens to a family member or a friend, or even if it occurs to ourselves, we're very shocked. I've never had a patient say, hey, I know exactly why I had that heart attack, or hey, I knew I was going to have a heart attack. No one ever says that. But in actuality, 80% of all heart disease is caused by uncontrolled risk factors. Now, in terms of risk factors, there are some risk factors that we cannot control, such as age or gender or family history, but there are many that we can control. And the number one, and as Cheryl was mentioning, hypertension is one of those number one risk factors. It is the leading cause for heart disease and stroke, and it can cause worse outcomes for people who contract COVID. And when it comes to hypertension and high blood pressure, African-American women, we have some of the highest rates in the world. And even if we know that we have high blood pressure, 75% of us have uncontrolled numbers. So when it comes to blood pressure, you really want to pay attention to it. You want to see your doctor on an annual basis. And this is even if you don't have any medical problems. Even if you're not having any symptoms, you should be having annual follow-up with your primary care doctor. And we expect that you should be knowing your numbers. First number to know, blood pressure. For most people, a normal blood pressure should be 120 over 80 or less. Sometimes my patients ask me, hey, which is more important, top one or bottom? They're actually equally important. So you want to talk to your doctor specifically about what your blood pressure is. When you go to the doctor, a lot of times your doctor will say, everything's fine, I'll see you next year. Really, you want to ask them, no, what was my blood pressure? And if it's not at goal, how do I get to a normal blood pressure? And this can include medications, but a lot of times it's something that is specifically within our control as well. Lowering our sodium in our diet, getting physical activity, making sure that our weight is what it should be. And so it's very important that you talk specifically with your doctor to get your blood pressure under control. Other risk factors that you can control include diabetes, cholesterol, tobacco use, weight, sedentary lifestyle, and also stress, depression, and anxiety. To know your numbers for diabetes, you should know your hemoglobin A1C. And this is a number, it's a lab draw. It can be used to diagnose diabetes, and it can also be used to determine how well your diabetes is being controlled. And so when you go to your doctor, ask them specifically, have I been tested for diabetes? If I have, do I have it? What can I do to change my lifestyle around so that I can improve my blood sugars? For cholesterol, you should know your total as well as your good, which is the HDL, and your bad, which is the LDL. And again, this is something you have to talk to your doctor about because there's different goals depending on your cardiovascular history, your family history, your other medical problems. So you really want to talk to your doctor and say, what is my goal? how can I best achieve this goal? When it comes to weight, we measure what's called the body mass index, and that's just a ratio of your height to your weight. And the higher your body mass index is, the more likely you are to have cardiovascular disease and many other diseases. When I talk to patients about their body mass index, they say, this is just a number. It doesn't take into account where, I have more here in my hips or I have more in my thighs. Body mass index is just simply a number, and it tells us what your risk is for cardiovascular disease. So you should ask your doctor specifically, what's my body mass index? How can I get into a range of healthy weight? For tobacco use, most people don't actually think to discuss smoking cessation with their physicians, but your doctor can be a great advocate in terms of providing resources and also medications, behavior modification tools, all of these to help you to stop smoking for good. This is even more important for us because as African American women, almost all of the risk factors for cardiovascular disease are more prevalent. 4 out of 5 Black women are considered overweight or obese, and this is the highest rate of any group in the country. We are 60% more likely to have high blood pressure than our counterparts. And this burden of underlying risk factors is what actually leads to us having the increased prevalence of cardiovascular diseases, and we have worse outcomes when we actually present after a heart attack or after a stroke. Another one of the biggest burdens now is just chronic stress. So stress is actually an independent risk factor for heart disease. And since the onset of the pandemic, deaths from heart disease and stroke have risen significantly. And this is particularly among African Americans. When we get diagnosed with COVID, we're 3 times as likely to require hospitalization, and we're 3 to 4 times more likely to die from COVID. And a large percentage of this has to do with cardiovascular disease. And there's a lot of different reasons for this. We're not doing our preventative care. We're not going to our doctors because we don't want to be exposed. When we feel like we're having symptoms that may be a heart attack, we're not going to the hospital because we don't want to have that exposure. And also stress. Stress is a huge, huge factor. Stress, traditionally, stress is supposed to be adaptive. It's supposed to actually help us out. So stress, it releases all of these hormones, and like if you were encountering a bear, you would have all these stress hormones flood your body, and it would help you. It actually help you either fight the bear or run away from it. It's called fight or flight. But for us, it's not stress that happens shortly and then resolves. We're under chronic daily stress every day. We're worried about our family members. We're worried about getting exposed every single day. And chronic stress actually wreaks havoc on the body, causes increased blood sugar, blood pressure, heart rate, and also stress leads to unhealthy lifestyle behaviors. So people are not exercising. They don't want to go outside. They don't want to go to the gym, increased smoking, increased alcohol use, and increased unhealthy eating habits. So over the past 2 years, I've done many more virtual visits with my patients than I have in the past. And when I talk to my patients, the majority of the time, they're sitting in the kitchen. And I know that when they're working from home, they're sitting in the kitchen. So when they get stressed out, they're right there. The food is easily accessible to them. And so I have watched my patients gain weight. I have watched them have their blood pressure go up when they were previously, really well controlled. I've watched them have, elevations in their blood sugar. And all of this leads to worsening of your risk factors, and then also an increase in cardiovascular disease. So this is something that we definitely want to address. So the AHA has released this campaign, and it's called Reclaim Your Rhythm. And it's a way for us to take charge. It's a way to empower women to take charge of their physical health and as well as their mental health as well. So just in the interest of time, I'm just going to share just a few of the main points of the campaign. Number 1, we need to mellow out and reduce stress. So again, that chronic stress, that's the problem, because it means that all of those stress hormones are there all of the time, all day long, wreaking havoc in our bodies. So you want to build time into your schedule so that you have some type of stress management, meditation, journaling, practicing gratitude. So taking time to say, hey, here's 5 things that I am happy for, that I am grateful for. Doing yoga, praying, and music is a big, big part of my household. So creating just a mellow out playlist to listen to while you're relaxing. Choose what works best for you, and then set aside 10 minutes each day so that you can invest in a healthier you. As women, we take on so much and we don't take care of ourselves, and no one else is going to do it for us. So we have to do it for ourselves. And I tell my patients all the time, you can't pour from an empty cup. So you have to take that time for yourself every single day. Stay on beat with blood pressure. So blood pressure is a big problem for African Americans and African American women. And again, it's the leading cause of cardiovascular disease that is controllable. So the best way that you want to keep your blood pressure under control is seeing your doctor on an annual basis, not only so that they can check your blood pressure, but also so that they can teach you the best way to check your blood pressure so that you can keep on top of your blood pressure yourself. Ways to reduce the sodium in your diet, ways to keep more physically active, ways to keep your health or your weight into a nice healthy range so that you keep your blood pressure under control. And finally, moving to the music. So every day I actually have time with my son where he says, hey, I'm going to pick an artist and we're going to explore this artist. And we listen to the music, we listen to the artist, we read about them, and then we say, okay, now we're going to listen to the music. And music helps bring movement, it helps bring the flow. And most of the time that I'm exercising, I'm listening to music as well. And physical activities is so important. It's linked to lower cardiovascular disease, improved mental health and cognitive function. And in fact, many studies have shown that Alzheimer's is significantly reduced by exercise. And also exercise is a break from that stress. So all day long you're stressed, and then you take that break and you exercise, and that actually helps to cut some of those stress hormones and make you feel better, sleep better, live better. American Heart Association recommends 150 minutes of exercise per week. Break it up however you like, 20 minutes a day, 15 minutes in the morning, 15 minutes in the evening. Doesn't require any equipment at all. Get on your tennis shoes, get outside, and get some exercise. So I hope that after this call, you'll be thinking of all the different ways you want to help improve your risk factors and immediately say, okay, this is something that I can implement into my lifetime that's going to help empower me to take control of my health and also my life. And I appreciate your time. Thank you very much.
That was excellent. Thank you, Dr. Wyche, so much. I enjoyed that. Next, we are going to have Dr. Kendra Outler speak as well. And I just want to remind everyone that we will be taking questions after the presentations. And we will also have a survey afterwards. All right, next I bring to you Dr. Kendra Outler.
Hi, good evening. And it's so wonderful to join you tonight. And thank you, Dr. Wyche. We like music in my household as well. So that's always been a staple. So I hope that people still remember the days when they would do the Soul Train line. I'm dating myself and do the bump with their cousins. That was always something that we enjoyed and still do to this day in my family. We will cut the rug, we will embarrass ourselves. And so it's exciting. So, and it's good stuff. And that does count as exercise. It does make you heart healthy. And it definitely makes the heart warm. And even with COVID, you can still in your household turn on the radio and get close. So I am an anesthesiologist, but prior to that, I was in family medicine. So I'm originally born in family medicine. So I've brought all that moving forward. As you say, you have to kind of keep reinventing yourself. So I reinvented myself into advocacy work with Uzima Health and Wellness. And so it's been a joy over the last couple of years to really explore the topic of health disparity, bringing in my background from public health and preventative medicine and as an anesthesiologist. And so as an anesthesiologist, I'm looking at blood pressures and controlling blood pressures all the time. And my world intersects with Dr. Wyche when I have to tell a patient you cannot be cleared for anesthesia until you see our cardiologist. And so, and this is really because uncontrolled blood pressure during surgery or during anesthesia can increase your risk of a bad outcome. Within 48 hours, it increases your risk of a heart attack. So I take blood pressure very seriously every day. And I also emphasize to my residents that if you see a blood pressure that is not normal, preoperatively or intraoperatively, do not dismiss it. We need to take it seriously. Hypertensive disease, again, is very prevalent in the Black community. There are studies, plethora of studies that go back, 30, 40 years exploring hypertensive disease in Black people. I think the first question is, do we have more cases of Black patients Black people with hypertensive disease? And that's yes. I went back through some of the studies. Yes, that was one of the earlier studies. Is this more prevalent in the Black community versus the non-Black community or the white community? And yes, by and large, we do have it more often. Then the second question is, do we have poor outcomes? And the literature resoundingly is yes, we do. So now we're in a phase where we're talking about health disparities more. Again, everything becomes full circle. We were talking about that actually in the 90s. I think Dr. Wyche could say that as well. And if you've trained at Washington Hospital Center or Howard, you would know it's a continuous conversation about disparities. So the second question is, do we have poor outcomes? And the answer is yes. Now we're also exploring why. Why is it that we cannot seem to close the gap on certain diseases and hypertensive and diabetes, but hypertensive will definitely continue to be at the top of the list. So when we think about the social determinants of health, we're talking about race, we're talking about geography, what your zip code is. We're talking about environmental factors, and under environmental factors, that's under nutrition. Nutrition would fall into that. And we also think about environmental factors such as infrastructure. How far are people away from healthcare centers? How far are women away from, during their pregnancy, good maternal care? Because we know that during that state, women's blood pressures can change. Other risk factors as well, we talk about stress as well, stress on the job. And so we think about socioeconomic factors that people come from. So again, with my work and my exploration of the literature, I'm always thinking about our communities that cannot speak for themselves. Sometimes we say things like go outside, but we know that there are some communities that are constantly under siege with gun violence. And so when we acknowledge this, how do we move towards understanding this disease within a continuum of all of the issues that Black folk have to deal with? And then that can spur us into action. Those who can help others, and other communities that can't help themselves have a voice. But when we look at hypertensive disease and how to affect change, we can't change our race. Some of us can't change the amount, our socioeconomic conditions. But we can start to look at some of the known factors that affect blood hypertension and or your blood pressure. The research is very clear that Black people tend to be more salt sensitive. And so I know that I don't have a salt shaker on my table, but that's something that we really have to consider. This is not something that, this is something that is in your control. How much your sodium intake has been it's very much documented that I think we're looking at somewhere between less than 500 milligrams of sodium. And that seems to be if you add up breakfast, lunch, and dinner, you're easily over 500 to 700 grams of sodium, milligrams of sodium, you can correct me, Dr. Wyche, that we need to make sure that we're staying in. So we're showing that African-American patients are more sodium sensitive. We are also showing that as you increase your decade of life, that the weight, the pounds that we put on seems to be higher for African-American women. Is that something that you control? Absolutely. But again, even our young girls are noted to be heavier, denser, more muscle mass at a younger age. So our BMIs tend to be higher than our white counterparts. So being a little bit heavier or having a higher BMI may not make you unhealthy. So then we have to ask ourselves, well, how much activity are you getting as you increase your responsibilities in life? College, you're kind of motivated, you may do intramural sports, but then the demands of life take off, and you think you're not walking as much, you're not working out as much, you have children. These things are very real for everyone. And then the pandemic has definitely made people more sedentary, afraid to go out, even outside to breathe fresh air. And so what are we fighting now? The COVID 10 or 20, because I know I have mine to put on, mine to get off. So these are very real things that we can think about: salt, your weight, and your amount of activity as you get older, to try to make these adjustments. Because again, some of us can't, we can't change our race, and some of us may not have moved out of our communities. And that's, that's not a bad thing, but we have to remember that access to some of the conveniences like fresh fruits and vegetables, gyms, local tracks, our communities well lit so that we can walk safely at night. Even with your best intentions, you may not have a good lighting, good infrastructure in our community. So we have to think about all these contributing factors to elevated high blood pressure and heart disease in the long run, which is what we want to avoid. But where does the disparity lie even outside of our community? And so in thinking about the medical community, it also lies within us as a profession, because the data is very clear that we have this higher prevalence. Then why is it that there's a delay in getting to see Dr. Wyche, a cardiologist? Why is there a delay in getting to see a nephrologist? Or why is there a delay in getting to see an endocrinologist? Because not all high blood pressure is just due to because you got high blood pressure because your family had high blood pressure. There could be definitely a hormonal reason for your high blood pressure. If you also have diabetes, you have to also think about controlling that. So there should not be a delay in getting to see a specialist. And that's where we can see the disparity. The disparity is, number one, why did a referral take a while for a person who is presenting with uncontrolled high blood pressure repeatedly, not being referred to a specialist so that the treatment can be more aggressively evaluated? The disparity lies in when particularly a Black female presents for chest pain, that there is a delay or an absence of a referral to an interventional cardiologist or the discussion of minimally invasive angioplasty being evaluated for her. So again, we have also well documented these delays from the health community. So this is where we continue to say, this is where the disparity is. This is where the racial inequities happen when it comes to heart disease, and ultimately how we end up losing a loved one to heart disease, stroke, and a heart attack. So I think as we want to be informed consumers of healthcare, that's important. We definitely want to be educated, but when we control both for finances, meaning access and that insurance, and access to big populations, the military population and the obstetric population, where you have access, where you are covered, we do see that Black women will have a poor outcome. And that's where we know that our medical community is not taking our symptoms very seriously. And so I would like to, pitch back to Dr. Wyche just to speak on that and how we can increase the awareness on our medical side to help bridge this gap and to close the gap in this health disparity.
Absolutely. So I certainly have had many African-American females tell me that they went to the emergency room several times, not just one, but several times, and were told that everything was fine, that they had anxiety, that this was musculoskeletal pain, and then they subsequently had a heart attack. And so in addition to empowering, each and every one of you to recognize the symptoms, I also have to empower you to advocate for yourself. So when you actually get to the emergency room, don't let them dismiss you. Say, I would like a cardiac workup. I would like an EKG. If the EKG is normal, I would like a stress test. If they don't want to do the stress test at that time, I would like a referral to a cardiologist. And that is the best way to make sure that you are getting the treatment that you deserve, because sometimes an EKG can be normal. Sometimes the enzymes that they measure to see whether or not you've had a heart attack, they can be normal, but that doesn't necessarily mean that you don't have cardiovascular disease. I think ultimately getting more people of color into medicine is what we need, because we understand and we can talk to our patients in a way that they understand. And we're much more aware of the problems that African-American people have in terms of their risk factors and in terms of their risk for cardiovascular disease. In the interim, though, I really want to make sure that people are advocating for themselves, and they're making sure that they're getting the proper workup when they do present to the emergency room.
So I would say the proper workup, I think that what we have to understand is that if you have, and you can correct me, when I was in family medicine, we had 3 elevated high blood pressure readings in 3 different settings. That was a diagnosis for, that was a good diagnosis for saying that the person has high blood pressure. If you present even one time with elevated blood pressure and what we call some type of in-organ symptoms, meaning that you've been a headache and a elevated blood pressure. You can also present in renal failure, heart failure, and one reading that's elevated. You can present that way and you say, no, I felt fine. Then you understand that you have some type of hypertensive disease and the whole workup. And the workup from that is starting off with an EKG, your full panel of labs, and follow up again with some imaging. Imaging can also be what we call the stress test with a cardiac echo. And it may not, given the constraints within the medical system, there are those constraints that you may have to be, seen over 3 or 4 visits. Okay, this may not happen all instantaneously, but you should know that these are the things that you should have once you present with high blood pressure. And again, particularly if you have other symptoms, headache, being told that your kidneys may not be working well, or your heart is showing signs of heart failure. What does that look like? The swollen feet that you keep explaining away that, oh, they're just puffy after standing on my feet all day. Those are real symptoms that can be dismissed by you, and so you have to tell the doctor, no, I think that this has been going on for a while. I really feel bad, every morning I wake up with this pounding headache. These are real symptoms that should not be dismissed as stress. But the workup should include, again, an EKG, a full panel of blood work, definitely a stress test, and an echo that looks at the functionality of how well your heart is actually pumping blood throughout the body. These are important markers to have. And the stress test, I believe, should be done even baseline without these symptoms at 40, if I'm not mistaken.
Yes, it depends on your risk factors, family history, and other risk factors that you have, whether they're controlled or uncontrolled. So yes, definitely stress testing, but anyone who has chest pain, and again, even if you've gone to the emergency room and they said everything was normal, I still advocate strongly for referral to a cardiologist. We have seen heart disease at earlier and earlier ages, and sometimes I'm actually surprised, I'm shocked to find that a 30-year-old has had a heart attack. And again, when it comes to African-American females, age 20 and older, 49% have some type of heart disease. Now, a lot of that might be hypertension, but still at age 20 and older, 1 out of 2 females have some type of heart disease. So it is very important that you make sure that you're advocating for yourself.
And the other invasive, non-invasive test that we've moved to as well is the heart scan. And that will look at the calcium deposits within the lining of the heart. And that's something that I would encourage everyone on this call to ask their physicians about, if they can be. It's called the CT scan, the heart scan, that's what it's called, but it's looking at the calcium deposits in the vessels of the heart, which could be a predictor of narrowing of the vessels, which could put you at risk of heart disease or a heart attack. So that's something to discuss as well. Your primary care physician and or your cardiologist can refer that to you, particularly if you know that you have a family member that's had a heart disease early. That's imperative that you examine your heart in multiple ways that you can. We also thought, and it's very important that we think about younger women and their numbers for blood pressure, and educating our younger women even as early as college to think about their blood pressures. Birth control pills can elevate your blood pressure. And so we have to also remind our young ladies that as they are growing and maturing, to see what those numbers are. Some patients now too are presenting with taking attention deficit medications. Those medications can also increase your blood pressures at a younger age. So if you're using them in college or medical school or graduate school, really understand that you're taking something that can elevate your blood pressure. So I always ask patients, is this a good number for you? Is this a number that you've seen over and over? And they'll say, oh yeah, that's my blood pressure. And that's the key. What is your blood pressure? And making sure you know that number. And we're encouraging patients to also put their blood pressure numbers on a smartphone so that they can record it. And then your doctor can see your trend. So there are lots of apps that can be used to track your blood pressure. And I just love when patients can show it to me in a pre-anesthesia evaluation. They can say, no, doc, this is my blood pressure for the last 2 weeks or the month. And they pull up the screen. And I'm very impressed because it's not just one blood pressure at a time. It can be a trend of how your blood pressure has been behaving over, a period of days or weeks or what have you. So I just want to encourage those things. And that's called, that goes back into getting into the rhythm of life, checking these numbers, your blood pressure, your weight, and also looking at your sodium amount, and then also how much your physical activity is or is not over a period of time. So thank you.
Thank you, Dr. Outler and Dr. Wyche. This has been amazing. I've learned some things myself. It's been a while since I've been within the cardiac unit, but I just love two things that you both said. I love that, Dr. Wyche, you mentioned women, we can't pour from an empty cup. That is so profound. Because I think all of us, especially those of us who are wives, mothers, everybody's a sister, a daughter, etc., we tend to take care of others before we take care of ourselves. Mm-hmm. And even though we're feeling, we have this stomach or belly ache, something doesn't feel right, or our jaw, like Dr. Wyche had mentioned earlier, we tend to have those atypical symptoms for a heart attack. We tend to brush it off and say, oh, I'm just out of sorts. I'm just feeling stressed. Or like you said earlier, maybe it's just a panic attack. But it's just so important that we stop doing that. Pay attention to your body. And I know as a physician, I tend to be a terrible patient because I do the same thing. Oh, it's just gas. I'll be all right. So I appreciate that very, very much. And Dr. Outler talking about advocating for yourself. I actually had a question for both of you, and then I'm going to jump to the questions in the chat. We had mentioned the BMI. Well, actually, both of you mentioned the BMI, the body mass index. My question centers around, do we look more so at the central adiposity, meaning your the diameter of your stomach, if you will, or your midsection? Do we think that may be a bit more important versus the entire BMI when it relates to cardiac risk? And I'll probably punt that to you, Dr. Wyche.
Okay. So yes, we definitely have a range that we want in terms of your waist to hip ratio. And central adiposity definitely increases your risk for cardiovascular disease. But I think that when we look at overall numbers in terms of what we want to kind of sort of focus on in general is the body mass index. Now, again, yes, we tend to be more muscular. And so, of course, the body mass index is going to be a little bit higher for us. But our trend is that, again, we're not only just overweight, but a lot of us are obese simply because of all of the preponderance of cardiovascular risk factors that we have. And so I think I want to definitely step away from saying, well, it's okay. She's African-American, so she's going to have a little bit more weight to her, because in a lot of cases, that's something that's actually increasing our blood pressure. It's actually increasing our risk for diabetes. And so I want to make sure that we really start to focus on that as African-American females, because this is something that's going to impact our heart and our health. And again, the numbers in terms of central adiposity, very important, but overall, our general health, as your body mass index increases, you're increasing the risk of cardiovascular disease, pulmonary disease, sleep apnea, fatty liver, many of these things, and they all correlate in a very direct line as the body mass index increases. So it's something that I definitely like to address when I talk to my patients.
And I'd like to say, when I put patients to sleep, and I just so people clear, I come from a family where the men have stomachs, and it seems to be a genetic thing that I see. I mean, it's 9 brothers and they all, they do, but they're fairly active. I was very concerned when my brother got COVID. He's a big guy, but I know that my brother exercises regularly. I know that his, the way he's built looks like to be a family trait. So we all have family traits that we have to consider. And I'll say that when I'm putting some patients on asleep, that, the stress of anesthesia, that even though they may be thin, I can tell they really are not exercising. And when we say exercising, again, Dr. Wyche alluded to it earlier, you don't need a gym. You need to be, taking those steps every day, that lead to, good vascular tone in the legs and throughout the body. And so take those seriously. There's some YouTubes that say, walking 5 miles in your living room. There's Sit and Be Fit. So there's great exercise programs that allow for you, if you're limited, to stay cardiovascularly healthy. So just so everybody's not shaped the same way, but we definitely want to control our weight. And we want to make sure that we are staying cardiovascularly fit.
Absolutely. Thank you. And just to be 100% clear, when we're mentioning cardiovascular, we're talking about the heart and the blood vessels. Pulmonary is dealing with the lungs, because there was a question before about hypertension. Hypertension is the medical term for high blood pressure. All right. So I'm going to jump to some of the questions in the chat. We did address the symptoms of a heart attack previously and what should prompt you to see your doctor. The next question is, what exactly are the top and bottom numbers in blood pressure? Meaning, what do they measure specifically?
So the top number is the systolic number, and this is when the heart is actually pumping. So this is when the heart is actively contracting, and then the diastolic is the bottom number, and that's when there's relaxation of the heart and also of the blood vessels as well. And as I said, both numbers are important. I have some patients who the systolic blood pressure or the top number is their only problem. I have some who the diastolic is their only issue, and I have some who are both, but they are equally important and both need to be controlled. And again, 120/80 or less is the goal for most people.
Thank
Dr.
you.
Wyche, I have a question for you. Have we changed that 120/80 to make it borderline now? There was some sense that we thought that was a little bit even higher. Is that true or not true?
So we had a couple of studies that came out a few years ago that basically showed the lower you can get the blood pressure, the better your outcomes are. And so our guidelines specifically for what was hypertension changed at that time. So previously, before, 130/90 was kind of like a pre-hypertension range. And so we didn't actually call it high blood pressure, we called it pre-hypertension. And you actually didn't get called stage 1 hypertension until you got to 140/90. And we changed that range so that actually 140/90 was stage 1 high blood pressure, and that anything over 130/80 was something that needed to be addressed. And at that time, it made it so that many more Americans got automatically diagnosed with high blood pressure. And a lot of people were very concerned because they were thinking, okay, now I need to be put on medications because my blood pressure is 136/89. But actually, what we were really recommending were that we really, really focus on lifestyle modifications for those people who are in that range. So if your blood pressure is 136 over 86, that's when your doctor should really be talking about lifestyle modifications. If you're exercising on a regular basis, you can bring your blood pressure down either top or bottom by 5 to 10 millimeters of mercury. If you're making sure that you're keeping your sodium levels nice and low, that also can bring down your blood pressure from 5 to 10 millimeters of mercury. Limiting your alcohol use to 1 drink per day for females, again, is another way. So increasing fruits and vegetables. Previously it was 5, now it's actually 10 fruits or vegetables that are advised daily. So all of these things, increasing potassium related foods, eating more leafy green vegetables, all of these are the lifestyle modifications that we're now trying to focus on for those people who previously were called hypertension, but actually now are considered to be or to have high blood pressure.
That is a great point, Dr. Wyche. And I'm pretty sure you remember Dr. Malhotra from Howard University, who always preached that we should all eat a Mediterranean diet.
Yes, and the Mediterranean diet is actually the absolute best diet for the heart. We haven't come up with anything better than the Mediterranean diet.
Thank you so much. And actually, you both mentioned sodium. The next question is having to do with salt. Carmen asked if pink salt and Himalayan sea salt are better than ionized table salt.
I mean, so, I have the feeling that salt is salt. I mean, they are telling us these things, and that this is less salty, but the studies do show that salt, and it does not distinguish Himalayan from ionized salt, the good old the one with the blue that your grandmother had in her house, or my grandmother did. It doesn't say a difference, and I would say that you may have found through some of the herbal literature that Himalayan salt, pink salt, is better. We also have to realize that is not what is being given to us when we go to eat out. And so your burden from when you, unless you're cooking 100% of all of your meals, it can be very difficult to control your sodium intake. And salt is in everything, from the biscuits you ate to the eggs that were scrambled, to when you pick up something like Panera, your sodium content can get well over 1,000 quite quickly. A nice weekend with your children and maybe a teenage diet, because you want Chick-fil-A and a slice of pizza, you're already into 1,200 milligrams of salt. So we have to, grams of salt, right, Dr. Wyche? So you have to consider those over a cumulative time. The literature is showing, and some of this has been delayed, that basically what is going on is that the renin level in the kidneys, and without getting into too much physiology, that changes for African Americans more than we think. And so some of the newer recommendations are that not only a part of the workup for high blood pressure, it should include numbers like aldosterone levels and renin levels that come out of the kidney that help regulate our salt and how our body responds to salt. There's the thought that those two things change in African American populations more than we think, which could be driving up our numbers more than previously appreciated. What's interesting is that if you look at the labs for those, they are not covered or part of the standard hypertensive workup, which leads us back to our advocacy work that says, that if you end up with high blood pressure and your doctor does not order a renin aldosterone level to be evaluated that you requested, or that we educate our practitioners to start to order that as part of a hypertensive workup.
And then also just keeping in mind that outside of all of the other ways that we can add salt, 80% of the sodium that we actually have during the day is already in the food. So even if we're cooking for ourselves, if you're using canned fruits and vegetables, you're adding salt. If you're having canned soup, if you're having processed meats like bacon, breakfast meats, all of those have a significant amount of sodium in them. So even if you're trying to cook at home and stay healthy, you still need to read labels because there's so much sodium that's already in food. And for people who are salt sensitive, so most African Americans are salt sensitive, even just a half a teaspoon of sodium can increase your blood pressure by 10 millimeters of mercury. So it's really, really something that we want to keep a close eye on. Read labels and don't add any additional salt to your food because it's already there. Most likely it's already there.
Excellent points. Thank you so much. There are so many good questions in the chat. The next question is asking about the percentage of hypertension in African-American women versus African-American men. Do we know those percentages?
Well, the percentages are about the same, actually. Again, African Americans overall have higher rates of hypertension. And when we're comparing to the world, we have the highest rates of hypertension. So I think that knowing that, it's something that we actually make sure that we are focusing on it, because again, hypertension is one of the leading causes of cardiovascular disease. And so making sure that you are checking your blood pressure, because again, sometimes you can go into your doctor's office and your blood pressure is elevated, and then when you come home and you check it, it's fine. And so you definitely want to make sure that you are checking your blood pressure yourself. You get educated by your doctor how to properly check your blood pressure, and also that you're having your doctor to check it annually as well, to make sure that you're keeping your blood pressure within an adequate range.
Thank you. Anita asked, where can we find a chart or information about a healthy weight based on height versus age? She said that she routinely sees conflicting information.
I guess I'm confused about the question. She wants to know the BMI at the height versus, and then how it changes for age ranges as you get older?
I believe so. There's actually, so she's asking about heights. Well, maybe she's asking about BMI versus age. And then there's also another question, asking about blood pressure versus age. So we mentioned earlier about the 120/80 or less is what we're reaching for. That's our goal. But is that the same for everyone, whether you're 20 versus 80 years old?
That's a good question. I'm like, when I am, what I appreciate for, and I've taken care of 97-year-olds and having to, put them to sleep. So again, I deal with blood pressures and extremes of age all the time. And so, one thing about anesthesia is, this living physiology, and what am I going to do? What should I expect? So as we are under the stress of anesthesia, I will tell my residents, my geriatric patients, there's a chapter on geriatric anesthesia where I don't want my patients to have a lower blood pressure. In 120/80 can be too low for some of my geriatric patients. And so we have to consider that. But we've been talking about blood pressures. If it's isolated, there's also that other important number, and that's your heart rate. And so you have to consider these are physiological changes that do happen, as 50, 60, 70, they're physiological changes that are happening to the heart, to the lungs over time. And so, we want to, that's when it's very important to see, the trends that a patient has over time. I think that, Dr. Wyche would even agree, as we get over 80 years of age, and 70 years of age, my mother's about to turn 70. So I have to consider what should her blood pressure be? And, we'll look at 120/80 or less for her. Her blood pressure may be too low. And then I have to consider what her heart rate is doing, because that will show me if it's too low, because the heart will start to try to compensate for her blood pressure. So, and then sometimes we think about, patients start to have dizzy spells, or are they because their heart rate is trying to compensate for a low blood pressure. So absolutely, blood pressure ranges do change as you get older and what you should expect to see. But again, we also say that, high blood pressure is high blood pressure, whether you're, 30 or 70. And it needs to be treated. And I think that I'm on message with Dr. Wyche when it said, when we think about treating blood pressure, it shouldn't be dismissed if a person has elevated blood pressures in their 70s. It should not be said, you're fine. If I give you blood pressure medicine to make you too low and then you'll get dizzy and fall out. That is not a true statement.
Thank you for that. Let's see. So there are a lot of questions in the chat and they're all excellent. We are running up to the end of our event, but I do appreciate everyone who asked questions. I would like to round this off to stress advocacy, that each person has to advocate for themselves, advocate for your family, but especially as Black women, you have to advocate for yourself. If you feel like your doctor is not listening to you, perhaps, and I'm not telling you to change doctors, but perhaps you need to find another doctor who will listen to you. Okay.
If you can't have a conversation like I'm having conversation with you guys right now with your doctor, then you should change doctors.
Absolutely. And I think we take for granted, especially those of us who are living within the DMV, that we have so many African-American physicians in this area. You have a plethora of doctors to choose from in this area. And it's not like that outside of this area. So like Dr. Wyche had said earlier, there's just a sense of commonality that we have. We're able to talk to you the same way, like Dr. Wyche just said. I can't talk to you the way that we're talking to you right now. If your doctor can't talk to you, maybe that's not a good fit for you. You know your body better than anyone else. Listen to your body. And if you feel that something is not right, go with it, talk to your doctor, find out what it is. Don't ignore it, please. All right. And clearly we've stressed heart health starts with our diet, exercise, avoiding salt, whether it's pink, Himalayan, or ionized in that blue box. We have to sleep to lower that stress, right? Sleep is important. We need at least 6 hours of sleep as an adult. 8 hours is best. I actually learned yesterday that more than 8 hours is actually not that good either. Very interesting. But in any case, I want to thank all of you for joining us this evening. I apologize that I'm not able to address all of the questions, but I thank you all so much for joining us tonight. And with that, I'm going to turn it over to, I believe I'm turning it over to Christy Holden, our Vice President.
Yes, thank you, Danielle. Thank you all for joining the Ladies of Iota Gamma Omega Chapter for our Pink Goes Red for Heart Health event tonight. Pink Goes Red is an Alpha Kappa Alpha Sorority Community Impact Day. As you learned this evening, heart disease is one of the leading causes of death for women. Thank you to Dr. Roquell Wyche and Dr. Kendra Outler for very important tips to help decrease these risk factors. We really appreciate all the information we received tonight. The Iota Gamma Omega Chapter, in collaboration with Ivy Community Charities of Prince George's County, have been serving the residents of Prince George's County and beyond for over 50 years and 35 years, respectively. Our focus is community service, programming, scholarship, and mentoring. Please like and follow us on our social media websites to stay informed of upcoming events. In order to best serve you, we would like for you to access our program evaluation that has been placed in the chat to provide feedback on our program this evening. Thank you again to Wanda Smith and the Women's Healthcare and Wellness Committee for organizing this program. Remember, ladies, please take care of yourselves so that you can take care of others. Have a great weekend. Stay healthy and stay safe.